Hello, and welcome to Lesson 3. I am Jessica Karnowski, and today we will explore the important process of history taking during medical visits. This lesson will help you understand what doctors need to know in order to get a clear picture of your health and how you can prepare to provide that information effectively. Before we start, I want to remind you that I am not a doctor and I cannot cure, treat, or diagnose any disease, illness, or injury. My role is simply to provide you with stress management tools and strategies to help you navigate your medical appointments and your healthcare journey with confidence. When you visit the doctor, the questions they ask might feel incredibly overwhelming or even unrelated to the main reason for your visit. But every single question serves a purpose. A doctor's goal is to gather as much relevant information as possible to create a clear and concise picture of your health. This process, called history taking, allows them to identify patterns, uncover the possible causes of your symptoms, and determine the next steps in your care. These questions aren't meant to judge or intrude. They're just tools to help the doctor help you. If the doctor doesn't have the full picture, they might miss something critical or even misinterpret what's going on and prevent you from getting the care that you need. Doctors ask detailed questions because they are essentially like detectives. They're trying to solve the puzzle of your health. Every piece of information you provide, whether it seems important or not, helps them understand what is happening in your body. Sometimes unrelated symptoms could provide the doctor with very critical clues to underlying conditions. Some lifestyle details like habit or exercise might help identify triggers or reoccurring issues. Family history reveals your risks for conditions like heart disease, diabetes, or certain cancers. So, with that, honesty is one of the most important things you can bring to a medical visit. Your doctor needs accurate information to assess your risks and rule out potential causes of what could be making you feel poorly. And then, using that information, they can make informed recommendations. If you leave out details because they feel embarrassing or irrelevant, it can totally delay a diagnosis or lead to inappropriate treatments. For example, imagine you've been experiencing fatigue, but you don't want to mention the occasional chest pain because you think it might sound dramatic. Or let's say you have shortness of breath, but you really enjoy smoking marijuana and tobacco, but you don't want to mention that to the doctor because you're afraid of being judged. Without that relevant information, your doctor might overlook potential cardiovascular causes for your symptoms. So, being honest about your lifestyle, your diet, your exercising, and about every symptom and habit you have, no matter how small, helps your doctor assess your health and support your goals. History taking is when the doctor asks you questions to piece together the mystery that is you. Some of the questions are answered when you check in for your appointment. You might notice that you filled them out beforehand. Others are asked when you are face to face with the doctor, or the doctor might have follow up questions to the paperwork that you have filled out. Let me explain history taking a little bit. It usually involves four key areas. We have the history of present illness, past medical history, family history, and social history. The history of present illness, or HPI, is a detailed account of your current symptoms. So it is who you are in this moment and what you're coming into your medical appointment and why you are coming into your medical appointment. Past medical history includes past surgeries, chronic illnesses, medications, allergies, or anything that has happened to you in the past. Family history covers health conditions within your family, such as heart disease, diabetes, or cancer. So they will ask you questions about your parents, your grandparents, your siblings. And if you just happen to not know those, you want to make sure to let your doctor know that you do not know the answer to those questions. Social history provides details about your lifestyle, including smoking, alcohol use, occupational risks, and exercise routines. Providing accurate and complete information in these areas helps your doctor connect the dots and make informed decisions for your health care. For the HPI, doctors often use the old CARTS framework to understand your symptoms. This stands for onset, location, duration, character, aggravating factors, relieving factors, timing, and severity. For example, if you say, I've had a sharp pain in my lower abdomen that started 3 days ago. It lasts about 15 minutes each time and feels like a stabbing sensation. It gets worse after eating, but improves slightly when I lie down. You're giving the doctor a much clearer picture than simply saying, I have stomach pain. And not only that, By following the old cards framework, you are saving time in that the doctor doesn't have to ask you those questions. You are already giving that information to them. Doctors are here to help you, not judge you. Their job is to help you manage risks you choose to take with your health, whatever they may be, but they can only do that if you provide them with clear, honest information. This shared decision making process ensures that your health goals and priorities are at the center of your care. If you might feel judged, dismissed, or misunderstood, remember that you have rights as a patient. You can ask for clarification, saying something like, "Can you please explain your reasoning for this further?" If your concerns are dismissed, politely request documentation in your chart, such as, "Please note in my chart that I requested a specific test or treatment and it was declined." And, if necessary, seeking a second opinion can often provide clarity and reassurance. Don't worry, we will thoroughly discuss these tactics in lesson 4 and 5 with scripts for you to memorize in case you have such high anxiety or you're feeling so ill during your appointments that it will be natural for you to respond in these empowered ways. Preparation is key to making the most of your medical visit. So, to get ready, you want to organize your symptoms clearly and concisely using tools like the old cards framework. If you look below, you will find a fillable PDF template to document all the questions that the doctor will ask you before your appointment. So once you've completed the template, you can either print it out and bring it to your appointment or save it to your computer and email it to your doctor beforehand. This ensures that even if you feel anxious or unwell, your concerns are clearly communicated and shows your doctor that you are willing to take the steps necessary to ensure that you get proper health care. History taking is a partnership. Doctors see many patients throughout the day, so your clarity and preparation make their job easier and ensure you get the best care possible. They might only have few minutes out of their day to see you, and if you come in with everything laid out on the table, that shows that you're willing to work together towards a positive end result. By working together with your doctor and being open, you're empowering yourself to live the healthiest and most comfortable life you want. In the next lessons, we are going to focus on presenting symptoms clearly and advocating for proper health. Together, let's keep building your confidence and your skills so that you can live the happy and healthy life that you want. See you there.